Standing gluteus medius level 1. So done perfectly, this exercise is much harder than it actually looks. And what you want to do to execute this perfectly is stand on one leg. And what you're looking for is to try to get your acetabulum, so the hip joint, as close to aligned vertically here without a kind of a Q angle right here. Best you can, try to keep that acetabulum over the patella tendon and then straight over the foot. So you won't want the knee going into adduction, and you won't want to have any excessive Trendelenburg type of action. You want to have the acetabulum directly over the patella, over the foot. Now, it is impossible to have that perfect, that the acetabulum is truly over the patella, because if you're like that, of course, you'd fall over. But you do want to try to minimize the amount that your body's doing this and significantly decrease, remove, get rid of any type of adduction or valgus action in the knee. Once you have that aligned, ideally you would be doing this exercise in the mirror, especially when you're learning this. Then what you want to do is, let's go ahead and do a 90-degree turn. Go ahead and stand on one leg, the right leg. What you want to see then is that the pelvis is in a neutral position. So you wouldn't want to have an excessive anterior pelvic tilt. You want to have kind of a neutral pelvic position like this here. Let's go ahead and turn back towards the camera. So once you have all that alignment, hold that position. Then what you're going to do for the actual action is you're going to do the action of the glute medius. The action of the glute medius is abduction, but there's a couple other components of the glute medius that really work that muscle, and that is coming into slight extension and also slight external rotation of the hip. So let's go ahead and do that again. So not only is she coming into abduction, not only do you want to come into abduction with this exercise, but also slight hip extension and also external rotation. For fitness doctor practitioners, this position of standing on one leg and aligning the pelvis neutral, aligning the acetabulum with the patella tendon, with the second and third toe of the foot. This is a crucial position for walking, for lunging, for step-ups, for so many different things. So you'll want to make sure your client is executing this to the absolute best ability that they possibly can, and that will require both your verbal and physical cues. So Patty, let's go ahead and go into the position. So let's pretend I just queued up my client, taught them how to do this exercise. She's starting this position. I would come around, make sure that her pelvis is properly aligned. I'd use my hands as needed to make sure the pelvis is both neutral and is not going into a Trendelenburg type of position, that she's actually level. Good, and let's go ahead and go into the exercise. Good, and so as in any exercise where, of course, both sagittal alignment and frontal plane alignment is both important, you'll want to both look at your client from the front, seeing how the alignment's going, making sure they're not going into a valgus knee position, coaching as needed. Maybe they even have foot pronation, so you're working on that too, making sure they're stabilizing from the foot properly, keeping an arch in the foot, coming again posteriorly, and stabilizing from the pelvis. So those are all the things that you want to look at in your client, making sure that they're executing to the best of their ability.